Hi everyone. For our final assignment, I decided to take on a client project in which I researched biologic medications and their efficacy on treating different symptom profiles of psoriatic arthritis. My client was an adult patient with an aggressive form of psoriatic arthritis. She is seeking information which will help her make decisions about her treatment. Psoriasis is an autoimmune disease which increases the growth of skin cells. Only in the past 50 years has psoriatic arthritis been identified. It is a condition which may develop in combination with psoriasis. It causes joint damage, and patients can experience a range of symptoms from mild to severe. There is no known cause or cure for psoriatic arthritis, and effective treatments of the condition are still being studied. Currently, biologic medications are the main treatment option for those suffering from psoriasis or psoriatic arthritis. My client is interested in learning more detailed information about the efficacy of various biologic medications for different symptom domains of psoriatic arthritis. The 6 domains of psoriasis are peripheral, hands and feet, axial, spine, hips and shoulders, skin psoriasis, enthesitis, dactylitis, and nail disease. I conducted the reference interview on the phone and through email. The reference interview provided me with useful background information which would guide my research. I established that my client had found information on medical websites, but much of this was too generic to be helpful. In searching for more detailed information about biologic medications, she has run into paywalls due to the regulation of scientific information. She provided me with a list of keywords that had been useful in her previous searches. After defining these terms for myself, I organized them into a table. My key subject terms were psoriatic arthritis, psoriasis, biologic medications, dactylitis, and enthesitis, and my related subject terms were methotrexate, leflunomide, interleukins, JAK inhibitors, tumor necrosis inhibitors, and T cell inhibitors. I defined a criteria for the databases I would search in. They had to be subscription-based medical databases, specifically covering pharmaceutical topics, which were frequently updated with the most current information. With this criteria in mind, I decided to search using Embase, Medline, and Web of Science. I began in Embase, using the database thesaurus to perform a basic keyword search of my 2 key subjects. I limited the date to the last 3 years. When I retrieved a high number of results, I decided to change the result ranking from sorted by relevancy to by date, keeping in mind that my client was looking for extremely up-to-date information. I identified a paper which looked promising, which was titled Sequencing of Biologic and Target Synthetic Disease-Modifying Anti-Rheumatic Drugs in Psoriatic Arthritis. Are we ready to redefine the treatment strategy? A perspective. It was a comparative commentary on recent research around the success of biologic medications for treating psoriatic arthritis. I sent this to my client, who responded saying that it was exactly the type of information that she was seeking. We got on a video call and went through the citations of this paper together, where she identified another paper of interest. Getting initial feedback from my client was a good way for me to ensure that my research was on the right track. Here I have gathered 3 examples of productive searches I performed in my research process. The first is the search I just walked through. Next is an example of a search I performed in Embase and Medline. My query was biologic and psoriatic arthritis or enthesitis or dactylitis and interleukins or T cell. Here I tried expanding my search by including the terms enthesitis and dactylitis, while also narrowing my search by adding the terms interleukins or T cell. This search produced an article I chose to send my client. I also searched using Web of Science, using the subjects psoriatic arthritis and biologics or biological medications. Using Web of Science was useful because I was able to assess relevancy of items based on the amount of times they had been cited. I selected 2 highly cited articles to send my client using Web of Science. In all, I sent 10 items to my client, and I received mostly very positive feedback. Out of the 10 items I selected, my client only described 1 as not useful. While my client found another article too specific, it focused on 1 biologic rather than many, my client found the rest of the items I selected extremely useful. I challenged myself with this project as I was researching an advanced and unknown topic to me, and I knew little medical jargon relating to psoriasis or biologic medications. I encountered several roadblocks along the way, including that some of the most recent articles were still behind paywalls, that the medical jargon was challenging to understand, and that many articles were either too specific or too broad. However, I felt satisfied that my search results had provided my client with information that she viewed as relevant and valuable. Here I have gathered a few examples of the article titles and the feedback I received. Thanks for watching.